Eating Disorder Awareness Week begins today, and I'm joined now by Lynda Duffy, the licensed RTT practitioner, on a cause that is very close to her heart. With just 3 public specialist beds for adults currently available nationwide, Lynda says early intervention is more important than ever. And having recovered from an eating disorder herself, she's passionate about raising awareness and offering practical, down-to-earth advice. Lynda, thank you so much for joining us on such an important topic.
Thank you so much for having me.
Can you maybe speak to us a little bit more, if you don't mind, about just why this week is so personally important to you?
Yeah, so for me, obviously, I'm a recovered. I had an eating disorder for over 20 years. So for me, it's really about just kind of sharing awareness. I think a lot of like a lot of mental health disorders, but especially eating disorders, they really thrive in secrecy. But I think healing really happens when there's a safe connection. And I think safe connection comes from sharing awareness. And that means for me, maybe sharing a little bit about my story or a little bit of knowledge about eating disorders, so people might feel more comfortable to come forward and try and find some help.
Having gone through an eating disorder for such a long period, Lynda, does it ever reach a point where you think that's just always the way it is going to be? When you're dealing with it for 20 years, you surely met moments where you tried to break the cycle but couldn't, and just resigned yourself to, well, this is the way it's always going to be. On my life, I am going to live with an eating disorder. And what was it that finally helped you get out of that?
Yeah, absolutely. When you have it for that long, and because it controls so much of your life, literally from the minute you wake up to when you close your eyes, it does consume kind of your headspace. So yeah, certainly there's times when you feel like this is just who I am, and you kind of nearly make peace with it, that like you could have worse problems almost, and that you just have to find the best way possible to try and deal with it. But I think for me, in terms of when I got to such a low point, it was when you get to that space, you become so hopeless that you actually stop trying. And I think when you stop trying, that's the point where you can't change because you've stopped trying. So I think for me, it was kind of getting to that point that I knew that you get so low that like my life is not going to change unless something drastic changed. And for me, it was a case of kind of, 20 odd years into it, kind of like, I can't do this on my own anymore, because a lot of the time I thought it was just to do it willpower. I'd kind of dipped in and out of therapy, talk therapy for a few years. But for me, just whether it was, wrong time or just I wasn't committing to it or lots of different reasons, I probably hadn't reached the point of where I was like, I know I can't do this. I know it's not about food, but I just don't know what's causing it. So that was when I resigned to kind of, okay, I need to take this seriously because I can't continue like this.
And having dealt with it for such a huge part of your life, it's understandable that you're particularly passionate about early intervention. Why is catching it early so critical? And what are some of the invisible signs people might miss in the early stages of an eating disorder, Lynda?
Yeah, so I think with early intervention is important with everything, but I think it's because so many people think it's to do with willpower. They think it's, coming from a logical place that, if I can just stop doing what I'm doing, everything is fine. But if we could stop doing that, I would have stopped it, much sooner than 20 years, So it's coming from a logical place that we feel like we can control it, but essentially we can't, because it's actually our subconscious mind that's controlling it. So, and what I mean by that is a lot of our habits, a lot of our unmet needs, a lot of our kind of coping strategies are through our subconscious mind. So in terms of kind of like invisible signs, so a lot of the time, like people think eating disorders, most people are aware of anorexia and bulimia, which anorexia, you get very visibly thin. Bulimia, it means people are physically making them sick. So those signs are a little bit easier to spot. But with people who maybe have binge eating disorder, maybe who are not putting on a lot of weight because they're restricting and they're balancing it out, it's a little bit harder to see the signs. But what I would say is if you do maybe suspect that somebody is suffering from an eating disorder, signs maybe to look out for is, they might get they might start avoiding social situations, particularly around food. They might start isolating themselves from people. They might have increased anxiety, particularly around meal times. You might notice that maybe they start lying about when they've eaten or if they've eaten or how much they've eaten. You might notice that they're getting very conscious of their body, their weight. Maybe they're exercising more than they used to. Maybe their self-talk, you've noticed, has got a lot more negative. Or another one would be sleep. They might be tired all the time because they're not getting enough nourishment. Or you might just notice that their mood, they might be just in a really low mood, and that's not normal for them. So they would be kind of, I suppose, the kind of like non-food related signs that like somebody maybe should look out for.
I'm sure in this issue, for those who see a friend or loved one who they suspect of dealing with an eating disorder, can feel like walking on eggshells. How can someone support a loved one without making things awkward or pushing them away?
Yeah, and I think that's where most people worry. It's what do I say without making things worse, really? And look, from having personally gone through it and now helping people, I think the most useful thing or the most helpful thing people can do is really just kind of lead with care and not confrontation. So definitely kind of like, be mindful of comments around maybe weight or around appearance, around maybe how much somebody's eaten. And I know a lot of the time we mean well when we say things like that, but maybe just kind of rephrase, what you're trying to say to something like, I've noticed maybe that you seem, a bit more stressed or a bit more tired or a little bit, more sad than usual. You can just maybe just ask, instead of asking, is something wrong, just ask, how are you doing? Because I think that's less intimidating for somebody to kind of come forward if you ask, how are you doing, rather than, is there something wrong? And sometimes, people won't want to talk. They won't want to open up just yet. And if that's the case, it's just not to put pressure on them and just say, listen, I'm here to talk whenever you want. But equally, more important sometimes is I'm here to listen, because sometimes we just want people to listen, because it's very hard to give advice when you don't understand the background to an eating disorder, because it's not about weight, it's not about body image. There's deeper there's deeper unmet needs that, if you haven't had an eating disorder, if you're not aware of the underlying needs, and if you're not a therapist, it's very hard to kind of give the right advice, because you're not meant to be an expert, right? So it's just being very careful with your language, but also coming from a non-judgmental space. And, nobody's perfect and nobody has all the right words. So just be kind of open, be there to listen, to talk, and just try not kind of make too much emphasis on their body image and the food aspect.
We're hearing, Lynda, there's just 3 public specialist beds for adults nationwide. What does that mean in real terms for people seeking help? And from your perspective, has progress been made in eating disorder services in recent years, or are we still falling short?
Still falling short. So like, I suppose a lot of mental health services, the resources aren't there, the budgets aren't there, and sometimes I suppose the care isn't there in terms of really understanding an eating disorder. So has it improved? Not with what I've seen in the last couple of years. Unfortunately, again, that's down to resources and budget. But it's the situation is the situation. There's nothing, really that a lot of people can do from it. It's a governmental issue or HSE issue. But I think when you kind of get to that point where maybe you might feel you need help or somebody needs help, is to use alternative services. So that means whether that's going to your GP, whether it's going to your local hospital, whether there's a lot of online services that you can use, and people like me, therapists, just kind of reach out to those people, because there is help there. It mightn't be, look, not everybody has kind of the finances or the funds to have private care, but there's also care there where, it is supportive, it's low cost, and just sometimes even having somebody to talk to, that can help a lot.
Well, look, we really appreciate you talking to us, touching on your own story, and just highlighting this important issue in this week of Eating Disorder Awareness Week. We reached out to the HSE for a statement, which I'm going to bring to our listeners in just a moment. But Lynda Duffy, licensed RTT practitioner, thank you so much for joining us on Morning Focus.
Thank you for having me.
The HSE statement mentions that they're committed to improving access to services for those experiencing eating disorders, that referrals for inpatient treatment are reviewed individually to determine the likely clinical benefits of admission, as well as other possible treatment alternatives. They say adults who have an eating disorder diagnosis and require inpatient care can be referred to any of their acute inpatient mental health approved centres around the country. There are 3 specialist eating disorder beds in St Vincent's University Hospital available to patients within the catchment area, and they say the HSE also funds beds within private hospitals with dedicated eating disorder programmes for adults where recommended by an adult psychiatrist. The statement also highlights a small number of specialist eating disorder beds are funded via the Treatment Abroad scheme. Between 2018 and 23, the HSE spent €20 million on private placements in Ireland and abroad to support people from all health regions to recover from an eating disorder. They say that the HSE's core focus has been the development of regional specialist outpatient eating disorder teams across both CAMS and adult services throughout the National Clinical Programme for Eating Disorders. Its statement also mentions that the HSE and the Minister for Mental Health, Mary Butler, have prioritised recurring investment in services for eating disorders, with almost €75 million invested since 2016 and over 110 specialist clinicians recruited, which has enabled the establishment of 11 consultant-led specialist teams with a further 3 teams currently in recruitment. And finally, they say they've a commitment of an additional €2.3 million in new funding secured for 2 more teams this year, which brings the total investment to €14.2 million recurring, resulting in important improvements in HSE eating disorder services.